Okay. So let's go back in your mind to when you were in school. All right. And what transpired as you were finishing that led you to where you are right now? Like, what did you take were you in some clubs? Were you taking particular courses that started to solidify the belief system that brought you to how you practice?
Yeah, so I took the CCSP in Florida, which is like the sports clinician, but in New Jersey they don't recognize that as a thing. But yeah, I think the sports training that I had was really great. I got to go to like the Do Action Sports Tour. I got to be a medic at the Women's Rugby Championship, and to see like real world sports injuries was really interesting. And also it helped me like get my bearings when I saw real intense things at the office. Like I've already seen them once. It's not my first time seeing them. So I think that because I did the sports council, that helped me to understand that I wanted to be like a diversified, integrative chiropractor to integrate different types of healing.
Right.
But I think the biggest thing about practice is that I had 5 years as an independent contractor. So before I had the overhead of my own office, before I had the overhead of payroll and employees, I was able to learn as an independent contractor where I only made money if I brought in patients, which was pressure on me to produce and perform right out of school. But I also saw how different clinics were run. And I noticed that patients responded well to four separate pillars that I really think led to my success. And so, number one was operational excellence. Like, I am going to do a full, complete exam. You're going to get orthos, neuros, height, weight, blood pressure. You're going to get actual diagnosis that is consistent with what's going on. But then we have a cheerful disposition here. People are coming in pain. So if they're having a massive sciatica episode, they're not going to be their best self. So when they come in, we're going to greet them with a smile. We're going to tell them we're so happy that they're coming in today and that we're even more ecstatic that they're choosing all natural chiropractic care. And then when we're persevering until task is completed. Because, there's a lot of things with insurance companies like, oh, is there a co-insurance? Is there not a co-insurance? Like, we're going to try to make sure that we cross our T's and dot our I's and persevere until task is completed. And by doing that, it goes to our fourth pillar, which is elite customer service. Like, we need to make sure that we are with them every step of the way and that they know that we care for them, which in turn allows us to have a ton of reactivations. We might not see patients for 4 or 5 years, but they remember the way they were treated. They remember the care they got. So when something happens, they come back to us. They don't seek out a new chiropractor.
Gotcha. Yeah. And all great points too. Sometimes they actually do. They tell you they never did, but they
Yeah.
did cheat on you a little bit. And they realize how good they had it in your office too.
Yeah.
I
And it's
think
like
they're a
we
better
and
patient
we
for having that happen.
yeah, we try to say, like, as long as you're happy, we're happy. There are some times where a patient will be like, I want you to use more force with me. And it's like, well, I'm feeling your body and I don't want to use any more force on that region. And then I'll refer them down the road to somebody else who I know has a heavier hand because if that's what the patient wants, I want to give them that elite customer service and a referral to the type of practitioner that they want. I
Right.
believe, and there's always more to come. If I refer somebody down the block, then more referrals are coming my way. So I don't feel that scarcity mindset. I feel like there's enough spines to go around for everybody.
Amen to that. That's good point.